Hi, it's Dr. Emily, functional podiatrist, here to speak to you about the dancer's pad and how you can use this pad properly, as well as which conditions it is most appropriate for. Now, some of my favorite conditions where I recommend a dancer's pad is going to be for sesamoiditis, maybe a sesamoid fracture. If you have any sort of jamming at your big toe joint, this could be a hallux limitus, this could be a bunion, this could be for turf toes. So whenever we are thinking about anything happening around our big toe joint or under it, that is where I want you to think about using a dancer's pad. Now, this dancer's pad specifically is from a company called Hapad. You can learn more about their pads at hapad.com, Hapad.com. And what's great about this dancer's pad is it's made with a very special felt that is designed to last the length of your shoes. In addition, it is skived on all of the edges. So if you use this in your shoes, you put it on your foot, you're not going to feel any sharp, thick edges that are going to be irritating. So now the placement of the dancer's pad is very important. I often recommend that you start by placing it directly onto your foot. I want my patients to feel really that full benefit before we move it to our insoles. So for the dancer's pad on your foot, you're going to find the placement so that the first metatarsal head, which is here, is essentially feeling where there's that void. You're going to then notice that the other part, the top part of the dancer's pad, is coming across your lesser metatarsals. The lower part is going to drop down, support a little bit to that first metatarsal and to the end of your arch. And then this is going to allow the first metatarsal head, which is where your sesamoids sit, to drop down without hitting the ground early when you walk. It also supports what's called first ray plantar flexion. Now, a lot of jamming and pain in the big toe joint is because that first metatarsal is stuck and there's nothing to help it drop, which is an important part of how we get through our first MPJ or big toe joint. Now, when you're comfortable with how it feels on your foot, we can move that to the insole. Now, if you're placing it on the insole, you can either place it on the top. Again, Hapads are skived, so you're not going to feel the irregular edges, or you could, of course, place it on the underside of the insole so that you're just feeling that offload from the top. You can, of course, add these to any custom orthotics. Actually, this is how I test them with my patients before I build them into custom orthotics, as I will first do a couple weeks with that dancer's pad to their foot or to an existing insole. If they like it, if it helps them, if it reduces their symptoms to their big toe joint or their sesamoids, I definitely add that to their custom orthotics. So if you have pain around or within your big toe joint, definitely check out the dancer's pad. For more on functional podiatry and foot health, please visit dremilysplickle.com.